Good morning, everyone. I am Megan Rogers with Indiana SHIP. I am the volunteer supervisor for Northwest region of Indiana. And I am here this morning to talk about the what, the why, and when of a very important season for Medicare beneficiaries, and that is fall open enrollment. So we're going to spend some time this morning talking about what this enrollment period is, who is it for, why you would want to take advantage of this enrollment period, and answer any questions you have. So feel free to chat in the chat box if you do have any questions. This is being recorded and will be on Facebook for 30 days, and then it will also be on our YouTube channel. All right, so without further ado, let's talk about Medicare Fall Open Enrollment. So this goes from October 15th through December 7th, and you can review your Medicare plans as many times as you need to. You can change your plans as many times as you need to, and coverage will start January 1st if you do make any changes. So what can you do? So you can change your current Part D plan to a different Part D plan. You can change your current Advantage plan to a different Advantage plan, or you can move from original Medicare with a Part D to an Advantage plan. Or you can move from an Advantage plan to original Medicare and get a Part D plan. Now, as I mentioned at the beginning, you can make as many changes as you want during this time. Now, most people are not going to make lots and lots of different changes, but this is an 8-week period, so a lot can happen in those 8 weeks. So if you come and you make a change at the beginning of open enrollment and you change your current coverage to a different plan, but then you have a health decline and you have new diagnoses, you may have new doctors, your medicine has changed, then the plan that you just picked may no longer be the best plan for you. There might be other options now. So you would want to review again. And if something else is coming up as a better option, you can change to that because you can make as many changes as you want. So just keep that in mind if and when you do make a change. If things change with your health or your medication, you need to do that review again before December 7th or before 11:59 p.m. December 7th. So the last change that is in the Medicare system as of 11:59 p.m. December 7th is what will start January 1st. Now, again, this enrollment period is primarily for people who have a Part D plan or an Advantage plan. So right about now, you should be getting the annual notice of change from either your Part D or your Advantage. You may have already received it, or it might still be in the mail and you'll get it in the next few days, next week or so. If you do not get it, you can probably look up the plan information online, or you can call your current insurance and ask them to send you the annual notice of change. And this is very important. You want to make sure you're looking at this to see what is changing, if anything, for your plan for 2026. So you want to see, are the costs changing, deductibles, copays, premiums? Are the benefits or coverage area changing? What about the drugs? Is it still going to cover your drugs like it did in 2025? And then you also want to double check the provider and pharmacy networks because those can change as well. And you want to make sure that your preferred providers and your preferred pharmacies are in network still. So this is not a required thing that Medicare beneficiaries have to do. I get that question a lot. You know, am I required to do this? No, you are not. If you do not make any changes or you do not review your plan, your current plan will just roll over to 2026 and you'll keep that for another year. Now, if for some reason your drug insurance or your Advantage plan insurance carrier is no longer going to be a Medicare insurance provider, or maybe it's no longer going to cover you in your area, your zip code, then you will get a letter that's saying that and that you must change your plan during fall open enrollment, or your plan will end on December 31st, and you won't have other coverage January 1st. And this is common every year. There's usually some that stop taking Medicare, or stop certain zip codes. We had a couple plans last year do that. Aetna, I think, had some that dropped. And then we do have Anthem, at least in northern Indiana's dropping a couple of their plans. And I know United Healthcare is reducing some of its areas as well. So if you're on an Anthem or United Healthcare plan, if you don't get a letter, you're good. But if you do get a letter, then it's going to tell you what you need to do. So if you get a letter, you do want to pick new plans for 2026. But if you don't get a letter and you're fine with your plan, you can let it roll over, and you don't need to do anything. You don't need to call Medicare. You don't need to sign up every year. However, it is highly recommended that you do review your plans at least once a year. Why? Well, as we saw on the previous slide with the annual notice of change from your insurance provider, the insurance provider can change their coverage, their networks, their costs. Another thing that happens is your medication changes from year to year, usually, sometimes. So when your medicine is different, that can very easily make the plan that you're on, either a drug plan or an Advantage plan, no longer the best option for you. There might be other plans that are cheaper. So this is just a good time to either confirm that it is still the best plan for you, or see that it isn't and find other options for you. And I apologize, the sun's out this morning. So let me close my curtains real quick here. All right, I apologize about that. And I think you can see me better now too. So a couple stories or examples of what can happen or what we can find when we're reviewing plans. A couple years ago, I assisted a lady in Marshall County, and she was giving me her medications. And she gave me an insulin and an inhaler so far. Now, those tend to be pretty pricey with the copays, $35 for insulin. Inhalers can be up to about $47 to $50, depending on the plan. So I already put those in the system, and she goes, well, here's my expensive one. And I'm like, okay, well, this must be a doozy, because these were expensive too. And she says, levothyroxine. Well, for those that don't know, levothyroxine is for your thyroid. And if you're on the generic, which is the levothyroxine, then it is very cheap. Now, I'm not on Medicare, but I just picked mine up. 3 months supply was $14. And most Medicare beneficiaries maybe $10 to $0 for the copay every month. And I did confirm she meant the generic and not the brand, which is Synthroid. And I said, well, how much are you paying for the levothyroxine? $92 a month. Well, I looked at her like she had two heads, and she looked at me like I had two heads. So I'm like, well, let's see what's going on. That doesn't sound correct, but let's see what's going on. So we put in all of her medicine, her pharmacy. I pulled up her current plan, and she was paying $92 a month. It was a covered medication. It was just not covered well by that plan. We found her a plan that would save her about $800 a year with copays. Now she had to pay a little bit more for the insulin. However, the levothyroxine was covered much better now at $1 a month for the copay. Much better. So, and even, $800, that was still savings for the year. And she was very happy with that. Not only are we confirming that you're on the best plan for you as far as co-pays go for your medication, but we're also helping you look at pharmacies. So I had a lady last year come in to review her plan and her husband's plan. Well, they were both on a WellCare plan. This year, that's $0 premium a month in Indiana. And I put in all of his medicine, looking at the husband's, and I go, okay, we can look up to 5 pharmacies. What pharmacy do you go to now? She told me the one they were going to now. I think it was Walgreens. And I put in, she was fine with us looking at some others. So we put in mail order, CVS, Myers, and then I asked what she thought of Walmart. She said, well, I'm not too keen on Walmart, but you can put it in. I said, that's fine. This is just showing you if you're on track with the pharmacy, with the plan that you're on, to make sure that's the cheapest pharmacy for that plan. And she was fine with that. I said, it doesn't mean you have to change. It just gives you information. So found out that the plan that the husband was currently on was still the cheapest. So we didn't need to change plans. However, the pharmacies, we found a cheaper pharmacy. So I looked it up, looked into it, and if she moved pharmacies, they would save about $600 a year. So I told her that. And she goes, well, what pharmacy do I need to go to? And I said, well, you're not going to like it. And it's Walmart. She said, well, for $600, I'm going to go to Walmart. More power to you. So that's another example of what you can look at during fall open enrollment, not only the plan coverage, but also the pharmacy coverage. What's going to be best for you in your situation, the plan that you're on, and the medication that you take. So those are just some examples of what we are looking for during fall open enrollment when we're helping you review your plans. Check the chat box. All right, no questions yet, but please feel free to chat in any questions that you have. So let's talk about some things that you should consider when you have a Medicare Advantage plan. So you want to check to make sure that the plan includes Medicare drug coverage. Most Advantage plans do have the Part D coverage built in, but there are a few that don't. So you want to make sure that it does have that drug coverage, even if you're not currently on medication. You want to review the plan's estimated total cost to you, premium, deductibles, out-of-pocket costs, co-pays. Those are all important things to be aware of. Check if the plan has extra benefits, vision, hearing, dental. Make sure that your healthcare providers are in network. You want to check the star ratings to see how Medicare and other people with Medicare rated the plan's care and services, and understand how the plans work with other coverage you may have. So if you're a veteran and have VA coverage, if you're on Medicaid, those are just some examples of other insurance that you may have, and wanting to know how it's covered with Advantage plans. All right, what are some things to consider with Part D drug coverage? So this is going to be things to consider for the drug piece if you're on an Advantage plan with drug coverage or standalone Part D plan. So you want to review the formulary. So you want to make sure that it's still covering the drugs that you're on. Check to see if the plan has restrictions. You know, are you going to need prior authorization for certain medications? Is it going to require you to go through step therapy? Or are there quantity limits? You want to see if your pharmacy is in the plan's preferred network, or if you're exploring mail order, what your medication would be on mail order. Now, mail order tends to be the cheaper pharmacy option on most plans versus the retail pharmacy. However, once in a while, I will come across a situation where mail order is actually more expensive than the mail order. So don't assume that mail order is cheaper all of the time. It's a most of the time situation. And then remember that your Part D out-of-pocket drug costs are capped. For 2026, the most that you will pay out of pocket for your medications that you pick up under your Part D insurance is $2,100. If you reach that amount in a year, you will pay $0 for your copays after that. All right, so how can you review your plans? Now, you can go to an insurance agent. Just remember that they do have some restrictions. They're not generally looking at all of the plans out there. They're usually just contracted with a few, but that is certainly an option using an insurance agent. You can do this yourself on Medicare.gov, and we're going to talk about that a little bit more on the next slide. And then you can also contact SHIP and a SHIP counselor. Again, we're free and impartial. We do use Medicare.gov. So we have access to all the plans available to you in that zip code. And why would you want to compare plans on Medicare.gov? So this is the official Medicare government website. It's unbiased. You can look at different plans, get personalized cost estimates because it's going to tell you the costs for your medications, deductibles, copays, based on all the pharmacies you put in. You're also going to see the Advantage plan out-of-pocket costs. And you can also make an account. So if you are a Medicare beneficiary, you can make an account and you can save your preferences. You can look at your claims. You can look at your current coverage, and your medications will stay saved in there. So from year to year, you're not having to put all your medications in there each time. You may have to update them if you've had changes, but you won't have to start fresh. All right, so that is our review of fall open enrollment. Very busy and important time. You can reach out to us at SHIP 1-800-452-4800 to get connected with a local SHIP counselor if you want an appointment. We do appointments in person, virtual, on Zoom or Teams, or over the phone. Let us know if you have any questions. I don't see any questions in the chat box, but if you are watching this recorded and have a question, feel free to post those and we will watch for those. We're alerted when there's comments on any of our posts, and we'll answer those questions for you. So without further ado, let's talk about what we have coming up. So for 2025, we have one live. Well, I lied. So for November, we have one live. November the 3rd, we are going to talk about if you can delay taking Medicare. That's one of our most common questions. If you or your spouse is still working, there are options to delay your Medicare. So Susan and I are going to talk about that important question that we get frequently. And then for the rest of November, we are taking a break because Susan and I will be very busy speaking to Medicare beneficiaries about their open enrollment review and looking at plans for 2026. We will be back in December, though. I think we have about 3 lives in December that we will be talking to you about. I know one is on the Advantage Plan open enrollment, and one is What's New 2026. And I can't quite remember the 3rd live, but I think it has something to do with what do you do now with open enrollment over? What are you looking for your new coverage for next year? So that is all we have for today. So again, if you have questions, you need to get a hold of us. Feel free to give us a call or chat in the chat box or send us a message, and I will get that phone number in the chat box in just a minute. But one more time, it's 1-800-452-4800. You can also go onto our website and find all of our SHIP locations on the website as well. But if you call that 1-800 number, they will get you connected with a local SHIP counselor. All right, everyone, have a wonderful day. Happy open enrollment, and we will talk soon.